So today we have a total of 82 new cases of COVID-19. 50 of those are confirmed cases and 52 are confirmed and 30 are probable. So 52 confirmed cases and 30 probable. There are no additional deaths to report, and we can now confirm that 127 reported cases have recovered from COVID-19. So the total of confirmed and combined cases now in New Zealand is 950, and as I said earlier, that's 82 more than yesterday. Overnight, we have fewer people in hospital with COVID-19, and today there are 10 in hospitals around the country, including one person in the ICU at Wellington Regional Hospital. All patients are in a stable condition. From our laboratory testing numbers, we can report the 7-day rolling average has increased to 2,264 per day. Yesterday, we did the highest number of single tests in a day. That was 3,631. So our total of COVID-19 tests completed to date is 33,116. And we now have capacity to do, should we need to, over 6,000 tests per day around the country. We are continuing to grow our supply and stocks of key components used in the lab process, and that includes swabs. So altogether we have more than 100,000 nasal and throat swabs in stock, and enough componentry for the full process for lab testing for 37,000 tests in the country, and supplies coming all the time from overseas and from inside New Zealand to continue our testing capacity. There is a high demand for nasal swabs, and our local manufacturer is ramping up production with 300,000 swabs due over the next 3 to 4 weeks. For the cases we have information on, there remains a strong link to overseas travel. That is now at 47%, as well as links to confirmed cases in New Zealand, 34%. We still have a small number, around 1% of cases that we have concluded are a result of community transmission, but we have around 17% still being investigated, and as I've said earlier, in the last couple of days, they may well transpire to be community transmission. We have 10 significant clusters, and there will be an update on our website around the clusters, but just the numbers for the three that are the largest are in Auckland, around the Marist School. The total number there is 60 cases. The second biggest is the one associated with a wedding in Bluff, and that has 55 cases. And the third is the one in Matamata, which has a total of 54 cases now confirmed. I'd like to just talk about the issuing of a Section 71F notice under the Health Act 1956, which I issued yesterday, and there's a copy of that notice on the covid19.govt.nz website. Now, essentially, the purpose of issuing this notice is to provide greater clarity for everybody about what the expectations are around self-isolation as we are in Alert Level 4. Now, what we've seen over the last week is a very, very high level of understanding and compliance with those expectations. There have been a few areas where there have been questions over the week, and the purpose of the notice is to provide clarification for people about what is expected under an Alert Level 4 lockdown situation. So the notice covers in some detail what those expectations are, and it includes really a good description of what an acceptable bubble type arrangement is as well. We also know over this first week that or so of the lockdown that there have been some people who haven't been, it's a small minority, but they haven't been following the guidance and the expectations, and so the notice sets out the rules for what's expected of everybody, and therefore clarifies the situations in which police powers may be exercised to ensure that we get that high level of compliance. And again, this is a public health notice. It underscores the fact that what we are all responding to is a major threat to public health in New Zealand, and it clarifies what the expectations are on every New Zealander to ensure that we can collectively address that threat, and where necessary that the police have really clear basis on which to act to enforce that. I'm going to hand over to Dr. McElnay now to make a few comments.
Thanks, Ashley. So I want to update you on our technical advisory group, which met yesterday. And one of the things that they discussed was the case definition. So the technical advisory group updated the definition of a case of COVID-19 to separate the respiratory symptoms from any travel history or known contact with a confirmed or probable case. Testing will now be available for people with respiratory problems suggestive of COVID-19, regardless of their travel history or contact with a confirmed or probable case, and fever is no longer a requirement. The technical advisory group also rediscussed recovery, and there has been no change to our recovery definition. An individual with COVID-19 can be released from isolation when at least 10 days have passed since the onset of symptoms and at least 48 hours of being symptom-free. A negative test is not required for an individual in isolation at home, although in some circumstances a test may be done at the discretion of the clinician where the patient has been in hospital. I want to just talk about face masks. We are watching very closely the advice that we expect to get in the next few days from WHO and CDC around whether or not people should wear face masks when out and about to limit the spread of virus from people who are infected but not showing symptoms. The best advice at the moment is that basic hygiene measures such as frequent hand washing, physical distancing, and sneeze and cough etiquette remain the mainstay of our defence against COVID-19. There are ways in which wearing a mask can be helpful, but there are also ways in which it could be harmful. We know that in some countries, it's common practice when people who are unwell to wear a mask when they go out. That's a good practice that protects other people. But there is also some evidence that wearing a mask can also do harm, such as when it leads to people touching their face more often because of the discomfort with wearing a mask. And that can actually increase the risk of contamination to your hand, and it can also give you a false sense of security. But we acknowledge that these kinds of conversations are important, and we do already have some resources about face masks on our website. And lastly, on Healthline, a reminder that Healthline continues to be available 24 hours a day, 7 days a week. The work the team has done to increase capacity of the services means that wait times are much less. They're on average about 5 minutes. Healthline handled 14,746 calls yesterday and continues to be a popular service for people concerned about their health. Related to this, we are, however, also seeing a trend in both primary care and Healthline of people with other health issues leaving it long to see their doctor or call Healthline because they're concerned that the focus should be on COVID-19. I want to reiterate that we have the capacity to provide appropriate care, so people with health issues should act sooner rather than later. Please continue to contact your GP and continue to ring Healthline.